Hi, my name is Dr. Allison Zebron, and I am a birth doula, postpartum doula, and physical therapist. And today I'm going to be talking about some of the pros and cons with an epidural. So if you're giving birth and you want an epidural or need an epidural. So let's talk about what an epidural is. I think most people kind of had the idea that, or know the idea that an epidural, it's a catheter that goes into your spine, and they're able to administer pain medication, and it numbs the lower half of your body so you don't feel the pains of the contractions. So that's kind of what an epidural is. So let's go into some of the pros and cons of an epidural. And the cons list is a little bit longer, but for some people those pros might be just what they need. It might be just a big factor for them, and that might be all that someone needs, is just hearing those pros, which is completely fine. So I'm here just to give you information so you can make an informed decision when you're at the hospital giving birth. So some of the pros of an epidural is that you don't have as much pain, or you don't have pain at all when you're having contractions or those birth waves. So the bottom half of your body is numbed, and you don't experience that pain. It might feel more like pressure, but it won't be that intense pain typically. So that's a big pro for people that like, hey, I don't have to experience those pains. I can go through this. This could be a little bit easier. Labor, especially if you've been laboring for a while, no pain can help you just get over that hump and push that baby on out. So no pain. So that's one big pro. That's why a lot of people choose to get an epidural. Another pro for an epidural is that you get some rest. So if you're not going through as much pain, or if you were going through pain and now that you get the epidural and it's a long labor, you're able to rest. That the pain goes away and you're able to rest just to get through the rest of the labor, because you never know how long labor is going to last. So you're able to rest, maybe get some sleep for a couple of hours and continue on with your labor. So that's another pro. Another pro is that it's relatively safe. We'll get into some of the cons, but it's relatively safe-ish for you and baby, relatively. And yeah, so those are pretty much the pros of getting an epidural. Oh, one more pro is that if you needed to have a C-section for whatever reason, let's say it's an emergency C-section, if you already have an epidural, then you are able to be awake, or you're able to be awake for the C-section, for the cesarean section, for the surgery. So you won't have to undergo general anesthesia. You won't have to be put to sleep. So you're able to be aware and a part of the birth of your baby in that way. So that's another pro of having an epidural prior to having a C-section, or prior to having an emergency C-section and something like that. So those are pretty much all the pros, which are good. So yeah, now for the cons. So cons: if you have an epidural and your lower body is numb, you're not able, if you have an epidural, your lower body is numb, so you're not able to walk around. And if you've seen me before talk about laboring positions, you're not pretty much able to do any of those labor positions. The only thing you're able to do is maybe lay on your side, which is a good position for laboring and pushing. So that's pretty much the only position you're able to get in. And I still advise you, if you're having an epidural or for any other reason you're confined to the bed, labor on your side, push on your side, just to give more space for the sacrum, which is the lower bone of your back, to move and give more room for baby to come down that birth canal. So if your lower body is numb, you're not able to change positions, and that makes labor a little bit harder, and you'll need more assistance for turning in bed and for pushing. So you'll need someone to either hold your leg up if you're laying on your side, or even if you're laying on your back, which I don't advise, you'll still need somebody to hold your legs up because they'll be numb. You won't be able to feel your legs for pushing. And with that being said, you also will not be able to necessarily feel as much or have as much sensation to know the techniques for proper pushing. So you'll need more guidance, and you'll definitely need a second person, a medical provider, to say, okay, push now, or push harder, or give you more cueing to get that baby down. So that is another con. So another thing is that if you have an epidural, you'll need constant fetal monitoring. So you'll need a fetal monitor, and it's going to go around your belly, and it's going to be there constantly just to see how baby's doing. And they want to monitor how baby's doing because with an epidural, the medicine that's provided may or may not affect baby, so they need to constantly monitor that. So the baby's heart rate can go up, the baby's or down, oxygen can go up and down, so they need to monitor baby to make sure baby is safe. And with that as well, usually or sometimes with an epidural, it can kind of start like a cascade of events. So if you've heard of that, with an epidural, if you have an epidural, it typically slows labor down, and that's why you're able to get rest. Typically slows it down so you can get some rest, but usually you'll need Pitocin, which is the synthetic form of oxytocin, and that's going to start speeding up your contractions. So if your labor slows down, they'll need to give Pitocin to speed it back up and to have more forceful and purposeful contractions to continue labor. So it's kind of like a play on what to do. So your labor slows down, so they administer Pitocin, but then you're in a little bit more pain because Pitocin is what's the word I want to use? It's not natural contractions, so they're going to be a little bit more forceful. So it's going to be a little bit more painful. So there's more pain, so you need to up the epidural. But then epidural kind of slows everything back down, so they need to up the Pitocin. So they're kind of playing on that game of like, okay, we need to balance things out to continue labor. So this can happen with an epidural. And with that, sometimes baby's heart rate is affected, and it may go up or down. So your baby may be in a little bit more distress. That's why they're doing that fetal monitoring to make sure baby is okay. Sometimes baby is not able to handle that, which may lead to an emergency C-section that needed to get the baby out. So that's that cascade of events that you may hear about a lot of times. Also with that, sometimes you yourself may need oxygen, or your blood pressure may go up or down depending on what's going on. So you need to also monitor your blood pressure. So you may have a cuff around you, and they're monitoring your blood pressure and your oxygen. So you may also have that going on as well. Also, since you're also in the bed and you're not able to move as much, so baby is not able to move as effectively down that canal. So if baby is not able to move effectively down that canal, especially if they're having issues breathing or there's less oxygen, if you're needing oxygen and less oxygen is getting to the baby, they're not going to be able to be moving around as effectively to wiggle and come down that canal, as well as the contractions aren't as purposeful in getting that baby down. So the baby may need to be assisted coming out of the birth canal with forceps or a vacuum. So that's when your provider may assist the baby coming out with different tools. So that's another thing that may or may not happen, or it may lead to an emergency C-section, is what I was talking about before. So in addition to that, I think the only other a couple more things is that after you give birth, you may have what is called like an epidural headache. A lot of people speak about that you may have a headache that lasts a couple weeks, or maybe off and on for a couple weeks, and it's really a pretty severe headache. So there's that, or even after for baby may have some issues breathing, so it's a higher risk that baby may be in the NICU just to recover with a little bit more intense care. And baby may also have issues with latching because they may be a little bit more sleepy from the pain meds, so they may have a little bit harder time breastfeeding, starting to breastfeed and starting to latch, which they just might have, you may have a little bit harder time starting that breastfeeding journey. So those are I think those are all of the pros and cons that I wanted to talk about today, just so you can just be more aware of what may happen with an epidural. And this is not for everybody. Some people have epidural, they're fine. None of these things happened. But for a lot of people, these things do happen. So I don't want you to just see just the perfect case, but I also want you to see that there are common cases that have all of these things. Just so you can be aware and you can make the best decision for you. So those are all the things. And yeah, so I hope this information was helpful for you in just thinking about what you want to do with your birth. And okay, that's it. I'll see you in another video.